There are hundreds of different diets on the internet that can help us lose weight. Annie chose a diet pill called leucocerin, but she didn't know how it worked. I think understanding the science of it can help us better determine if we should try it or not. In this order, I will introduce leucocerin, what it is, how it works, the possible negative effects, the corresponding experiments, and the relevant references. I will also consider whether my friend Annie should take this medicine in the light of her data, and I will end with some of my own suggestions. Leucocerin is a new obesity treatment used as an adjunct to low-calorie diet and exercise in overweight adults. It was approved for marketing in the US in 2012. It works primarily as an serotonin 2C receptor agonist. This means that it activates serotonin receptor in the brain that are associated with satiety. By activating these receptors, leucocerin is thought to increase the feeling of satiety after eating small amounts of food, thereby reducing calorie intake and contributing to weight loss. The medicine is a more rational choice for 5-HT2C than other related targets. The recommended dose is 10 mg orally twice a day with or without food. If patients do not lose 5% of body weight by week 12, we should stop further dosing. Compared to many diet pills that has been withdrawn from the market, leucocerin has advantages in terms of efficacy and safety. But that doesn't mean it is a perfect weight loss drug. In December 2012, the DEA proposed classifying leucocerin as a classic 4 drug because of its hallucinogenic properties at higher than approved dose and the potential of users to become psychologically dependent on the drug. Some of the side effects that may occur with the use of leucocerin are constipation, dry mouth, excessive fatigue, headache, or other vision changes. If you experience more serious side effects such as hallucinations, difficult breathing, muscle swelling, or contemplation of self-harm or suicide, it is important to stop taking the drug immediately and call your doctor or receive emergency medical treatment. The weight loss drug does not provide all the necessary nutrients. In the past, there have been concerns about potential side effects, including serotonin syndrome, especially when taken with other drugs, the increased serotonin levels, valvular heart disease, and cognitive effects. I learned on the FDA's official website that since sibutramine was withdrawn in 2010 due to cardiovascular harm, all weight management drugs have been required to undergo cardiovascular safety trials as a condition of plenary approval. After testing, there were no significant results in clinical trials for those side effects. Another data from American Heart Journal, volume 202, August 2018, page 39 to 48, from Eric K. In the further secondary analysis of Camilla 61 showed that patients taking leucocerin might be at a higher risk of developing cancer. The trial was conducted on about 12,000 participants over 5 years, and more patients taking leucocerin were diagnosed with cancer compared to those taking a placebo. So, in February 2020, the FDA requires that leucocerin be withdrawn from the US market due to the increased incidence of cancer found in the long-term trial. Also, Camilla shows that the incidence of headache after discontinuation was 0.25% in the placebo group and 0.62% in the leucocerin BID group. Bloom was a 2-year crossover random controlled trial that investigated the efficacy of leucocerin 10 mg BID compared to the placebo. As can be seen, the percentage of participants who lost more than 5% of their body weight in the year 1, and the percentage of participants who lost more than 10% of their body weight in year 1. The primary endpoint at year 2 was the percentage of participants who lost more than 10% of their body weight. They lost more than 5% of their body weight in year 1 and continued to lose weight in year 2. At the end of year 1, the mean weight loss was significantly greater in the locatory group than in the placebo group, 5.8 kilogram and 2.2 kilogram respectively. The proportion of participants who lost more than 5% of their body weight was 47.5% in the locatory group versus 20.3% in the placebo group. 22.6% of the locatory group lost more than 10% of their body weight versus 7.7% of the placebo group. The graphic below shows the weight loss efficacy of locatory in a random controlled trial versus placebo. These trials prove that locatory's functionality and efficiency during its use is impressive. At this time, the cause of the cancer is unclear, and we cannot conclude that locatory contributes to the cancer risk. However, we want to make the public aware of the potential risk. This is what FDA said in its announcement. Given that the FDA has asked for the drug to be withdrawn from the market due to the safety concerns, I think the long-term use of locatory needs to be questioned in terms of sustainability, efficacy, and safety. In this page shows the approval history of your doctor might order certain lab tests to check your body's response to locatory before you can have it, because locatory is a controlled substance. MBI is a formula for testing the health of the body. It is measured by dividing weight by height squared, which in Annie's case was 80 divided by 162 squared, and the result was 30.4. Although the normal range of BMI is between 18.5 and 24.9, Annie may count as obese, but I think Annie's number is near the minimum of the range, and it is better to choose the other way to lose weight if you have an option. Also, the people tested had at least one obesity-related comorbidity, which Annie did not have a history of. So I think she did not need to lose weight by this means. An approach to weight loss that focuses on long-term health and sustainability is also very important. While locatory might seem like a quick fix, the safety concern and its withdrawal from the market are a major red flag. In my opinion, I recommend consulting with a healthcare professional to discuss alternative, safer, and potential more effective weight loss methods that are consistent with your health goals. In addition, a balanced diet, regular exercises, and healthy lifestyle are effective and safe strategy for achieving and maintaining a healthy weight. Thank you for watching this presentation. Here are the references I used.